Hello, my name is Ari Javidan, and I'm the project manager for the National Consortium of Telehealth Resource Centers. Welcome to the latest presentation in the NCTRC webinar series. Today's session is entitled CISA Services, Federal Cybersecurity Resources for Telehealth, and it is hosted by the Northwest Regional Telehealth Resource Center. These webinars are designed to provide timely information and demonstrations to support and guide the development of your telehealth programs. Just to provide a little bit of background on the consortium, located throughout the country, there are 12 regional telehealth resource centers and 2 national, one focused on telehealth policy and the other on telehealth technology. Each serve as focal points for advancing the effective use of telehealth and supporting access to telehealth services in rural and underserved communities. A few tips before we get started. Your audio has been muted. Please use the Q&A function of the Zoom platform to ask questions. Questions will be answered at the end of the presentation. Please only use the chat feature for communicating issues with technology or communication access issues. Please refrain using chat to ask questions or make comments. Please note that closed captioning is available at the bottom of your screen. Today's webinar is also being recorded, and you will be able to access today's and past webinars on the NCTRC YouTube channel or the NCTRC website at telehealthresourcecenter.org. With that, I will pass it over to Nikki Parasho, Program Director of the Northwest Regional Telehealth Resource Center.
Thank you, Aria. Welcome, everybody. It is my honor today to introduce our speakers of today's CISA webinar. Travis and Bob, if you want to go ahead and turn on your cameras. Travis Light serves as Montana's Cybersecurity Advisor for the Cybersecurity and Infrastructure Security Agency, or CISA. CISA works to strengthen the security and resilience of the nation's critical infrastructure. Cybersecurity advisors coordinate with local critical infrastructure operators to share cyber threat information, develop cyber risk mitigation strategies, and respond to cyber incidents. They also provide cybersecurity resources. Next up, I would like to introduce Bob Bastani. Bob is a Senior Cybersecurity Advisor for Critical Infrastructure at the Administration for Strategic Preparedness and Response, ASPR. He also co-leads the government-wide Cybersecurity Coordinating Council for the health sector and the joint healthcare and public sector. Cybersecurity working in his role. Mr. Bastani works with federal government, state, local, tribal, and territorial entities, and public and private owners and operators of critical infrastructure. He also works with healthcare and public health facility managers in order to improve the sector's cybersecurity risk posture. So without further ado, I'm going to hand it over to Travis and Bob to take over the show.
All right, thanks, Nikki. And let me pull up my slides there. Right, are they displaying okay?
Yep, looks good.
All right, fantastic. Right, hey, good afternoon, everybody, and good morning if you're on the West Coast still. Just introducing today CISA, some of the federal resources that are available, what we're doing in the federal government to help serve critical infrastructure providers, which includes telehealth providers too. And more on that in a moment. As Nikki said, Travis Light, I'm the cybersecurity advisor for Montana. CISA has an entire cadre of cyber advisors across the country, and we're here to help you. I'm joined today by Bob Bastani with Health and Human Services, ASPR, like Nikki mentioned, for strategic planning and resources. And we'll talk a little bit too about how CISA and Health and Human Services are working together. So a little bit of background, if you haven't heard of CISA, we'll cover that at the end, just at the beginning here, go over the current threat environment, introduce the Joint Cybersecurity Toolkit, cover the Health and Human Services cyber performance goals, and then finally close out with some additional resources, leaving time for some questions at the end. If you are unfamiliar with CISA, haven't heard of us before, we are the newest federal agency. We are within the Department of Homeland Security, and we actually will turn 6 here on November 26th, so we're just shy of 6 years old as of today. Really, we serve as the national coordinator for critical infrastructure resilience and response. meaning that we cover both cybersecurity and then physical security as well. We also have missions to protect chemical security for critical infrastructure owners and operators, and telecommunications. So really, we're here to protect all of critical infrastructure in that variety of different categories there. We're here to defend today and secure tomorrow via wide range of services, both on technical layers, on strategic layers, and to work too with a concept that I'll introduce in a moment, and that is the sector risk management agencies. Some of our core capabilities, we're here in a non-regulatory capacity to help bolster cyber defense across the country, physical defense across the country, again across those critical infrastructure owners and operators. You'll hear me say that many times. Some of the ways that we do that is to build the community, build partnerships, make sure that the appropriate agencies and organizations within states and between states are actually communicating with each other. In some ways, we are able to share information on current threat actors, on current indicators of compromise for the latest cyber threat activity, down to those individual organizations, and also to take lessons learned to feed the broader regional and national communities. We also work in incident management and response. Hopefully we're able to get ahead of that so you're not dealing with cyber incidents, but in the event that that happens, we are here to provide some amount of support. We're also here for risk assessments and analysis. More on that later. I mentioned technical services. Those feed the network defense service that we provide, and then emergency communications. We work, again, across all 50 states, closely with local, with state, and with private sectors too. We are divided into 10 regions. You'll see this regional concept applies to several other federal agencies. I think FEMA might have been the first to divide the country like this, and everyone else liked it and jumped on too. I believe that Health and Human Services is split into regional offices like this as well. You'll see too, and I'll provide the slides at the end. You've got the email contact to reach out to whoever your closest region is, so feel free to do that. All right, I mentioned critical infrastructure sectors and sector risk management agencies. So I want to go over some background there. 2013, federal government established these 16 sectors. And you can see where healthcare and public health, and obviously where telehealth fits into that concept too. And on the right, you'll see the primary federal agency responsible for managing the risk, managing security in that agency. So for healthcare and public health, you probably already guessed this, that it's Health and Human Services is the sector risk management agency. CISA supports communication and coordination between these 16, but we are not the lead for providing security to healthcare and telehealth. So for that, I'll turn it over to Bob, who is with Health and Human Services, for more information on how that looks from their perspective.
Thank you. Good morning, good afternoon, everyone. And it's really good to be with you today. A little bit about, so my colleague Travis talked about the HHS being the Sector Risk Management Agency for Healthcare and Public Health. So within HHS, the Administration for Strategic Preparedness and Response, ASPR in short, is the designated operating division that has that responsibility for the risk management agency activities. And in HHS, like many other federal agencies, HHS is also a very large and diverse organizations with many operating divisions. And we have a lot of our subject matter experts spread across the division, and really in that aspect plays a strong role of project management and coordinator. And that circle that you see is all the different organizations within HHS that touch different parts of healthcare and public health. For example, FDA plays a big role in medical devices, especially as interest to this group, telehealth group. And CMS does a lot of processing of billing and so on. So when there is an incident in healthcare and public health, it touches a lot of these different divisions, and we do that coordination with the different groups. One thing to bring up here is that we, in our role as SRMA, we are purposely firewalled from the divisions that have responsibilities, or the part of the division that have responsibilities, regulatory responsibilities. So things that are passed to us, we don't pass to them. And therefore, there's that level of trust that we are trying to build separate from our regulatory agency. Our goal is aligned. It's really pretty much laid out by CISA. We work very closely with CISA, and we take a lot of our leads from CISA. It is ultimately to strengthen the resiliency of healthcare and public health against cyber threats, and be in a position to respond to cyber threats and protect the patient information. Next one, please. So as mentioned, I work very closely with Healthcare Coordinating Council, Cybersecurity Working Group, and it's basically a joint public-private partnership. It has membership, 400 plus membership from all subsectors of this sector of healthcare and public health, from healthcare providers, hospitals, pharmaceuticals, medtech companies, and health IT companies. And basically, we have a large number of task groups. We work on different aspects of cyber risks to address the cyber risks in this sector. And also within this, there's also an HHS 405D task group. Is one of the task groups, the HHS 405D program, which is a large, again, it's another large partnership between public and private entities, and it develops a very detailed guidance on how to prepare the sector for cyber threats, and to respond to cyber threats, and also how to do a lot of training programs and so on. Next.
Right. Thanks, Bob.
Yeah, I think I'm turning this over to you now. Yeah. Thank you.
Yep. Got it. So I want to highlight too, so each of these 16 critical infrastructure sectors has a sector coordinating council that's intended to be this collaborative effort between not only the federal government and then state and local governments, but especially that private sector. In this case, from what I've seen, the Healthcare Coordinating Council is by far the most developed. They put out a lot of good information. A lot of what we'll present later actually was born out of this Health Sector Coordinating Council, specifically that cyber work group. I just kind of browsing through the list of the 400 members, I haven't seen many that are dedicated really to telehealth. So that might be something, if there's anybody on the call who's interested in. This is, as far as I know, it's a volunteer. There is a way to join this group and kind of inform some of their publications. And speaking of their publications, it's a few years old now. I think it was published first in 2021, but there is a guide to securing telehealth and telemedicine that they published too. A lot of what we'll talk about that's cyber related, it applies both to telehealth just as much as it would traditional brick and mortar type clinics and hospitals. So just keep that in mind. Health Sector Coordinating Council. There's links to it that I'll provide later in the presentation. It's certainly something to go check out. All right, moving on to some of the current threat environment. So threat actors come in a variety of flavors, each with their own goals, with their own motivations, and their own levels of sophistication as well. We've seen a rise really in just about all six of these, from hacktivists that started targeting water and wastewater systems following the October 7th attacks last year. Crime has been cybercrime has been lucrative, continues to be lucrative. Haven't seen that tamping down anytime lately. Insider threat, and we'll cover this too on the next slide, but insider threat isn't necessarily malicious, but certainly can be. It kind of goes hand in hand with espionage, cyber terrorist attacks and warfare too. We've seen a lot of real world examples of that, not only with the conflict in the Middle East lately, but also between Russia and Ukraine. Going back to that Health Sector Coordinating Council, a lot of what the resources that they've provided are built around these 5 flavors or categories of cyber threats, including social engineering, that'd be traditional phishing, scams, that sort of thing, and also business email compromise. We've seen a huge rise in that, which is like phishing, but a far more sophisticated version, where organizations are able to compromise somebody's specifically an email account that they've compromised, and then they're able to send out what look like legitimate invoices that then get paid, whether it's an invoice or a request to change bank account information for payments, etc. That's social engineering is it's hard to defend against, although there are several ways to do it. But of these, seems probably like the least sophisticated avenue versus ransomware attacks, where ransomware, in short, a threat actor is able to gain some kind of a foothold onto your system, and they're able to encrypt all of your files, all of your data, all of your programs to prevent you from accessing them. They then try to sell you that decryption key back. Ransomware we usually see also where they've first exfiltrated or stolen your data so that they're demanding a second or additional fee for you to gain access to your data again, and prevent them from selling that on the dark web. Third category, loss or theft of equipment or data, kind of goes hand in hand with those ransomware attacks, or really just preventing you, denial of service, so that especially you out there providing telehealth services don't have access to the tools that you need to do to function really. Insider or accidental data loss there has we've seen a huge uptick in that as well. And then attacks against network connected medical devices. All these new Internet of Things or the smart technology, each of these, especially since they have some kind of a connection to the internet, whether it's that they face the public internet themselves or that they're accessible via, say, a smartphone or a local network. Each of these provides some kind of an avenue for an attacker to gain a foothold on your system, or they're able to just compromise that medical device itself. I want to highlight too, ransomware attacks, loss of data. Each of these has been far more lucrative than compromising other personal identifiable information. That personal health information goes for far more on the dark web than, say, your social security number or a credit card information. And a lot of what leads to that increase, where it's so much more valuable to compromise health information, is that one, it's something that doesn't change. If your credit card is compromised, it's too easy to call and get a new credit card. There are monitoring services in place if your social is compromised. There's less that's able to protect against your health information. So it's been far more lucrative. There's also concerns about how sensitive that information is in particular, and also just the compromise. If you have that data on somebody, you have a whole new way of attacking them. So just throwing out there that health information is lucrative, and I have some quotes here that'll kind of highlight that in just a moment. I know everyone's excited about AI these days. And it's important to remember that threat actors can use AI too. They're using it to create more sophisticated, more credible social engineering tactics. They're able to use AI to generate and build malware and find new vulnerabilities in existing software and hardware. Folks are compromising your AI services or even poisoning the data so that, in short, since this isn't a full presentation on AI, but to deliver bad information so that when a patient is looking to find information from an AI service on whether this a procedure or medication is safe, the AI says yes, those two can be combined, no problem. When in reality that's not true. But the data that AI is pulling from has been compromised or poisoned. So something to consider. The Health Sector Coordinating Council has a great publication on integrating AI and machine learning in healthcare as well. All right, so I have some case studies here that are not meant to name and shame these affected organizations, but really just to kind of drive the point home. Each of these is widely publicized. You can find far more information on it just by Googling. But I want to highlight Prospect Medical Holdings that was affected last year, specifically by ransomware. And because their systems were compromised by ransomware, but that ended up closing emergency rooms. They had to divert ambulances. Of those 16 hospitals that were affected, at least 3 of them were still diverting ambulances from their hospitals for 17 days following this ransomware attack. So you can see how even though the ransomware is just compromising their IT systems, that it has real world impact. Thankfully, I haven't heard of any deaths that were attributed to this, but you can see the impact that something like ransomware can have in the physical world. They did have to revert to manual processes for processing records, labs, radiology, etc. And then also patient data was stolen and sold on the dark web as well. You do see on the right there the HC3 alerts. Going back to Bob's slide on Asper and some of the subdivisions of that, HC3 was one of them. Probably more on that in just a bit. The next case study that I imagine most everybody on the call is probably familiar with, the compromise of Change Healthcare, which is a software provider within United Health, processes, I believe, the most of claims of any organization in the country. Were hit by ransomware earlier this year, and really the effect of that on individual clinics, hospitals, etc. A lot of them were worried that they weren't going to be able to keep the doors open. Providers were having to dip into their own pockets to try to make payroll. Again, just like with Prospect, folks are having to go back to processing prescriptions and insurance claims by hand. The potential ransom that was paid was claimed to be $22 million. The actual economic impact of that was far greater than $22 million. And then they put out that there was a significant portion of U.S. citizens' data that was compromised, probably in the tens of millions. I know that personally, my family each got one of the letters in the mail saying your data was compromised as part of this. And I pulled that picture from TRICARE Communications just to show the risk of supply chain attacks. So Change Healthcare wasn't TRICARE or military hospital or any individual hospital, really, but that supply chain attack really had so many downstream effects, including on military readiness here. And sadly, within just a few weeks of that initial hack, Change Healthcare got hit again. So while they're trying to recover and restore services, you restore some systems that might still be vulnerable to that threat actor. They got hit by a second time by a different group. Again, just within weeks of the first. So certainly something to inform your cyber incident response programs and planning. So pull just a couple of quotes, one from my deputy director, and then as well as Deputy Secretary for Health and Human Services. and really just kind of quit stopping all of this. That healthcare organizations have a combination of PII, financial info, health records, countless, usually vulnerable medical devices that really have made them a one-stop shop for an adversary. We've seen a significant rise in the number and severity of cyber attacks against hospitals and health systems in the last few years, and they expose vulnerabilities in our health system. They also degrade patient trust and ultimately endanger patient safety. You can see, especially from Prospect and the interruption of the emergency services, how a cyber attack can actually have those real world consequences. So really the threat landscape is that healthcare tends to be the top target lately. So that's fantastic. All right, so moving on to the cybersecurity toolkit and kind of, hey, federal government, what are you doing about this? It's just some information here. We have published, it's really easy. You've got a link on this slide when these slides are sent out to everybody, but CISA.gov/healthcare consolidates a lot of CISA's resources, Health and Human Services resources, including some that we'll cover here in just a moment, some of our free technical services, how to get in touch with us, how to sign up for alerts and advisories, available both online and in-person training and exercises, and then incident response guides. One of those that you can see, there's the Health Sector Coordinating Council, CMS, HHS 405D, conducted a resiliency landscape analysis, huge survey that they published this last year of health providers at all different levels, small, medium, large, et cetera. I want to cover just some of their findings there because really that informed a lot of what we're doing in the health sector. So key findings: growing threat of ransomware, kind of already covered that. Variable adoption of critical security features. You probably heard of or are familiar with multi-factor authentication. They did find that something like 90% of the hospitals surveyed had some form of MFA, but maybe not against their most critical systems or what they might identify as their crown jewels, the data and systems that they really want to protect. Vulnerability assessments is another one where a lot of organizations out there are doing vulnerability assessments, but maybe don't have the capacity or the resources, the manpower to do something about the findings of those assessments. Training and outreach, again, is something that a lot of organizations and clinics are doing, but maybe they're not tailoring that training to the appropriate folks. So really, as it would apply to telehealth, be very interested in seeing some kind of applicable training rather than just the general awareness. But also, hospital at home, unsurprising that this is on the rise and introduces all sorts of new vulnerabilities, all sorts of new attack vectors, but really that they haven't been targeting hospital at home so much yet. Email protections were way up. A lot of what's built in to alert to suspicious looking emails or to filter, those have been up across nearly every organization. It was something like 98% of them. Supply chain risk is pervasive. Change Healthcare, perfect example, far from the only one. And as I said, medical devices so far generally aren't targeted. I expect that to change. A few more findings: inconsistency across the health organizations as far as where the weaknesses are, which does make it harder for us to address those, but really just kind of establishing a baseline for cyber practices, which we'll get into in just a moment, so that everyone is at least meeting the minimum for protecting themselves from the most opportunistic attacks. Across the board here, use of antiquated hardware, software, and systems. Hopefully, we see this less in telehealth, but also there's always the question of is the hardware that people are using at home, is that up to date? The cell phones and the operating systems of those phones that they're using to access our services, are those up to date, or are there like flashing red lights because they're using an old version of Android or iOS or something like that? Insurance premiums continue to rise. That's a whole nother discussion, but really the insurance companies for probably about 5 years ago, the default was to just pay a ransom or pay a threat actor, whatever they were asking, and maybe even negotiating that cost down. Insurance groups have not been excited about paying that, and so now they're looking to either raise premium prices or they're looking to require customers meet a certain baseline for cyber. So when we start talking about the cyber performance goals, keep that in mind. Can lead to reduced cost in insurance premiums. Probably goes without saying, recruiting and retaining cyber talent, huge challenge. But also adopting these baseline cybersecurity practices works. So across any of those practices, the organizations that were following them had much better results and far fewer incidents than those that weren't adopting those practices. All right. And I want to introduce, I mentioned them a few times, the cyber performance goals. Want to cover kind of what those look like. I mentioned that healthcare and the Health Sector Coordinating Council has been kind of leading the way as far as the sector coordinating councils go. Another way that they do that is with these cyber performance goals. So 2022, CISA published what they call these cross-sector cyber performance goals. They're meant to be voluntary guidelines that are just capturing almost cybersecurity 101. If you're doing nothing else, do these minimum things. Well, the healthcare sector took that, ran with it, and developed their own cyber performance goals tailored to healthcare organizations. There are 10 essential goals that are really that 101 level, and then 10 enhanced goals. If you're meeting the essentials, focusing on those enhanced goals would be the next step. And Bob's here to tell you far more about the CPGs as they relate to healthcare than I can.
Okay, thank you, Travis. And just to tell you that CPG, when we talk about CPGs, CISA has also developed a set of guidance, performance score guidelines for all the industries as a whole. And the CPGs that we've customized really has been very much in synchronization what CISA has developed, but they're tailored for healthcare and public health based on the vulnerabilities that we have seen in healthcare. So, why should we have the CPGs? I think that the idea of having these performance goals, which, by the way, right now they are only volunteer and recommendations, at least for now. But with the question comes that why have this? What drove this? We talked about that. Travis set the stage. You've seen just enormous amount of increases in cyber attacks in healthcare. I think we've seen some very big incidents this year, and we saw some last year that really affected the delivery of care. And when we look at these incidents, the cause of these incidents, we see that some of the vulnerabilities that were compromised, that they were exploited, were really somewhat basic, and they could have been avoided with some really basic steps. There are a lot of numbers in this, and I'm not going to go through this. You can see that the percentage increases in breach and ransomware that we've had to deal with, and that survey that we did, that study that we did of healthcare that Travis went over, really identified a number of reasons. Some of them are mentioned here. Healthcare and public health, really, they run on very small margins, and the cybersecurity is very much underfunded when it comes to investments. That's even a much bigger issue in the smaller hospitals, the smaller remote entities when the choice has to be between buying a new IT equipment or a new X-ray machine, and the funds are very limited. And we've also seen that the threat landscape has been evolving, and it's now with the introduction of new tools, AI-based tools, both on the offensive side and on the tooling side, we see that the landscape has really increased, and the attacks are a lot more sophisticated, and the landscape is much larger. And the sector as a whole has complained that they're getting way too many guidance from different parts of federal government. NIST has a lot of guidance. We have generated random guidance. CISA has a lot of guidance, and they were really wanting some centralization of these guidance. So this really set the stage for developing these basic performance goals for the sector, and that's how they came about. If you can move to the next one. So a little bit of overview of what these CPGs are. They were developed in coordination with a lot of work between CISA, HHS, and the private sector entities, and to develop these guidance. So this was not something that we developed in vacuum. They are pretty much NIST-based guidelines, and there's a clear map to NIST framework, and also to 405D guidance for achieving them. The basic set of recommended controls that are just minimal controls that we would like the entities to put in place. These are really address the very prominent known risks that we've seen there. So they are easy to do. For the most part, they're easy to implement, and there's a large value, the return value for putting them together. And as I mentioned, a big part of the CPGs is to really sort of simplify the landscape of controls and demystify this framework, all the frameworks that are out there. Next. So we have the essential goals and the enhanced goals. As I said, the essential goals are basically the floor, a set of floor safeguards. And the essential goals are listed here. We talk about mitigating known vulnerabilities, enhancing email security, making sure you have multi-factor authentications, and make sure that you deploy encryption both at rest and in transit, and guidance on putting controls, how to put controls for credential management, and big user and privilege account management. We see this being exploited all the time, where there's no separation between users and their access levels. And these CPGs are applicable both on the supplier side and on the vendor side. And then connected, in addition to that, we also have a set of enhanced goals. And these are for more mature organizations that have already put the essential goals in place, and they are looking to enhance their defenses. And really it targets the more sophisticated attacks and more impactful attacks. And these are things like making sure you have asset inventory, and this third-party vulnerabilities, and that this third-party vulnerability is really big, especially I'm thinking within the telehealth environment, as you're dealing with a landscape that involves many different providers, all the way from telecom providers to different cloud providers and so on. And each of these providers provide an opportunity for introducing vulnerability to the entire landscape, and just being able to manage that vulnerability through contracts sometimes, and others to manage that landscape. Next. Again, I talked about how the goals are really mapped to NIST controls, CISA CPGs, and the HICcup practices. And if you go to the site that they're linked here to they're links here to the CPGs, it would be, you can see that clear link, and I think that does a huge service to demystifying and deconfusing this landscape of controls. Next. I talked about the 405D program, excellent program, lots of really good resources that are available there to how to do certain things, how to, for example, build awareness campaign for your environment, how to do outreach, training material. There are a lot of posters that have been developed there. And so strongly urge you to go to the 405D website and take a look at all the valuable assets that have been developed there. And by the way, they're all developed really mostly by private sector partners. Next. I think, do I turn this over to you at this point, Travis?
Yep, I'll take it back over here to close it out in a few minutes. So Bob mentioned the 405D program, and again, that's another one within ASPR, then that knowledge on demand bit. And we at that joint toolkit link to the 405D program, that knowledge on demand bit especially. And so it's written not for the technical folks among us, but it's written mainly for not only for providers, but decision makers, C-suite execs, that sort of thing. That cybersecurity training and awareness is intended for a broad audience. And you can see too that for the knowledge on demand, it's aligned with those 5 threats that we covered earlier. If you start the social engineering, and again, this is all free, it's all available on the website. So feel free to check it out. You've got a whole course on each of those threats, and there's far more to go into as well. So more kind of background on what CISA is and does, at least as it relates to the CPGs or those health industry cyber practices. So I mentioned I'm a cybersecurity advisor here in Montana. There are at least 2 of us in each state now. There are additional ones for some of the larger cities. So there's at least 100 of us, and we're really available here to answer questions, help you understand your current cyber posture, and maybe kind of give gap analysis for things to improve either right now or on a more strategic long-term goal. So some of those, what I do on a daily basis is I visit not only, obviously, since I'm covering 16 different infrastructure sectors, not just clinics, but I will go to a hospital to sit down for however long they'd like to, whether it's a 2-hour assessment or a full day assessment, and talk through how they align to those best practices. Are you thinking through not just from technical controls, but going back to those CPGs, things like, are you managing your supply chain, or at least are you considering cybersecurity when you're contracting with vendors? If you are outsourcing or using a managed service provider, what kind of controls do you have in place to log their activities, that sort of thing? So reach out to your local CSA and you can have a discussion with them, or they're funded to come to you at no cost. Some of the technical pieces down there. Want to highlight the vulnerability scanning. I've got a whole slide on that next. If there's one takeaway today, it's sign up for that vulnerability scanning so that you know what the rest of the worldwide internet already knows about your system. And then also we provide remote penetration testing services. And so long as you pay your taxes on April 15th every year, these are available all at no cost. You might be curious, all right, so if I have the federal government come and talk to me about my cyber posture, what happens with that information? The good news is that with CISA, since we are non-regulatory, is the assessment information, that vulnerability information, it is protected under both this protected critical infrastructure information program, as well as a few other federal laws as well. So that information that you're sharing with us, it's protected from release under FOIA requests, under state sunshine laws. It's protected from use in civil litigation, and it's protected from use for regulatory purposes. Now, obviously, if there's some kind of an incident, you still have to report that to HHS, but we're talking specifically on the vulnerability assessments, the risk assessments. You talk to us, that's not being fed into some broader government database or repository of information. Back to that vulnerability scanning, it is limited right now to IPv4 addresses, but if you have a static website that has an IPv4, or you have a static VPN service or something, this provides external vulnerability scanning, again for free, that lets you know what the rest of the internet already knows. You're getting, if it's on the internet, it's getting scanned usually multiple times a day by multiple people. That's just a fact of life. So you might as well know what the rest of the internet knows about your system. It is a continuous scan, meaning that it is no less frequently than once a week. I highly recommend it. One of the easiest things to sign up for, and you get a nice report card like the one on the right. We also have resources for stopping ransomware, meant to be sort of a keep saying one-stop shops here, but this is ransomware, protecting from ransomware, understanding kind of the latest threat activity from ransomware actors, and then just an assessment too to see where you stand and how well protected you would be from likely ransomware groups. Going back kind of to what Bob mentioned earlier too, so many of the attacks that we see, the overwhelming majority of attacks we see are opportunistic. And following those basic cyber practices, the cyber performance goals, stop what we see from there. Going back to the Change Healthcare one, that had to do with not having multi-factor authentication on a particular server. So again, identifying those crown jewels and implementing those basic cyber practices really thwarts threat actors and those opportunistic attacks. Want to highlight too that we have cyber tabletop exercises. I've hosted some here within the state that are focused on healthcare, that are focused on whether it's local government or others. But we have a national cyber exercise team that can come to you. They will work with you to develop a exercise that's tailored to your organization, whether that's kind of a coalition, maybe one of the regional telehealth resource centers, wants to host a program for telehealth organizations within their area. That'd be a great place to start. You also have the pre-made tabletop exercises linked there. And then finally, want to cover protective security advisors. I'm a cybersecurity advisor, so I talk a lot about cybersecurity. CISA also has a whole cadre, probably at least 100 protective security advisors as well. If you have some kind of a brick and mortar location, if you have a data center and you're curious from a physical security standpoint, your guns, gates, guards, cameras, doors, etc., reach out to them. They have their whole fleet of assessments and best practices similar to us on the cyber side. So with that, I think, Aria, I'll turn it back over to you to kind of moderate questions.
Thank you, Travis and Bob. That was great. That is a lot of information and a lot of useful resources and links and information for our rural healthcare systems and critical access hospitals. Let's see. Ari is answering some questions in the chat. I don't think we have any specific questions, and so I'll give everybody just a minute. I just want to express the gratitude for these resources and that our federal government is sponsoring this, because this is so necessary in this day and age, and just the education about dual authentication and other small steps that organizations can take to protect themselves and in preventing cyber attacks moving forward.
Yeah, absolutely. And I'll add too, we mentioned the cross-sector cyber performance goals. They really only came to fruition, and I think version 1.0 was published last year. That landscape resiliency analysis was published last year. So much of this is new, is developing, and we're trying to take input not only so it's not only the federal government telling you what to do and what right looks like, but we're taking that feedback from private sector and from local government to kind of feed the broader community's best practices.
Excellent. Well, I just want to share that these slides will be available and the recording will be available as well, both on the NCTRC website and the NRTRC website. And I want to thank you both for your contribution today and being available. And also, I do want to highlight, as Travis had said, that each state has two CISA representatives. So, please make sure you reach out and identify who they are. And I see Bob has something to add.
Yeah, thank you. I just wanted to mention, since you talked about the state CISAs, there's a task group within the joint cyber working group that I mentioned that is looking at the cybersecurity of public health specifically. And there is a survey that had just gone out that targets specifically the public health community. And I just wanted to put a little plug about that. I will send you some information about how where that survey is located and take it. And we really, really like to get the CISOs, the state CISOs and the state CIOs to participate in that survey. It's really important because the result of that survey will be used by us to request funding. For example, if funding is identified as a gap, we go back and request funding. If there are legislative changes that needs to be done, we will take that result of that survey and drive that. So, but it is really depends that survey and the work the after survey work really depends on the participation of public health community. So I will make sure that you will get information about that, and if I could have you distribute it, it'd be grateful.
That would be great, Bob. Yep, we will put that in our newsletter that goes out. It'll probably go out in the January newsletter, if that's okay.
If there is any, so the survey closes in December. So if there's any way that you can distribute it outside of that would be really, really
yes. Yep.
Great.
Send me and we'll make it happen. We'll send something out earlier before the month of November's over. We did have a question that attendee is wondering if there's any way to know if their organization is working with you now.
There is a list. We have a list. And actually, if you go to the HSCC, I think Travis had a link to it. We actually have a list of all the organizations that are engaged with and that joint cyber working. So you can easily see that.
The Sector Coordinating Council?
I assume that was a question about, I'm sorry.
No, I'm not sure either. I'm actually typing a response right now. But yes, there's it's a public list of who's part of that work group. And then also, if you're interested in knowing, hey, are we already signed up for something like the vulnerability scanning service too, I can look that up for you.
That would be great. Any other questions out there? I'm getting a lot of thank you for the detailed information. Thank you for the presentation. We're getting a lot of that in the Q&A. So I think I think people really appreciate these resources and this information, and we're just going to need it more as we move into this digital space. And so good to plant the seed and just let people know that you're all out there, just like the TRCs, to utilize at no cost to them. And hopefully we can make change. Anything else that Bob or Travis you want to add before I hand it over to Aria to close up shop?
I just want to express my gratitude for this opportunity. Thank you.
Yeah, I greatly appreciate the invite, and I'll add just anecdotally here at the end. All of my work in the healthcare sector, which has been an awful lot the last 2 years, came from someone in the vulnerability scanning had a vulnerability that I reached out to contact them about, and it just led to this working with the Montana Health Hospital Association, Montana Primary Care Association, Montana Medical Association, et cetera, et cetera. So just those, you might not even think of it, but these little, communications, that community building really can snowball and have a much broader effect on the broader healthcare community. So certainly get in touch with your local CISA cybersecurity advisors.
Travis.
Thank you again to Travis and Bob for their presentations today. Just a reminder that we do not host a webinar in December due to the holidays, and so our next webinar will be held on Thursday, January 16th, 2025. That webinar will be hosted by the Mid-Atlantic Telehealth Resource Center. Registration information is available on the NCTRC events page. And then lastly, we do ask that you take a few short minutes to complete the survey that will pop up at the conclusion of this webinar. Your feedback is very valuable to us. Thank you again to the Northwest Regional Telehealth Resource Center for hosting today's webinar, and to Travis Light and Bob Bastani for their presentations. Have a great day, everyone. Goodbye.
Thank you.